Hey there, thanks for joining me again. I assume you're here to learn a little bit more about a comprehensive guide to wound care, tools for the everyday clinician. So during this video, I'm going to talk a little bit about how you are going to become a different clinician after taking this seminar, a better clinician. I already discussed in some of the other videos how during the course we go over the whole kit and caboodle when it comes to wound care. We give you all of the core basics that you need to know, what the different types of wounds look like, how to properly stage a pressure ulcer, how to know what wound treatment to provide depending on what type of wound it is, things like that. We go into how to formulate a program in your facility and really carry over the skills into a bigger and better way. But you're also going to come away with it just knowing different terminology, different, we already said you're going to know all the different types of wounds, but then you're also going to be able to identify some of those characteristics that you'll see as a wound evolves or as it breaks down or as it heals, and just different terminology and different characteristics that you may have overlooked prior to taking this seminar. So what we do provide is a wound care terminology cheat sheet here, if you can see too well on this view. But you can see there's pictures on both sides with a name at the top and then a description. And these are things like what cellulitis looks like, what exudate looks like compared to eschar, what a papule is compared to a pustule, things like that. Hypergranulation, induration. And what this is going to do is it's going to just allow you to further assess the person's skin and the person's wound to a more specific level. And then you're also going to be able to document that in that way as well. You're going to be a documentation wizard by the time this is over. So it's a title that is very, very rare. So, you definitely want to be in that category. But no, you'll be able to really bring it to a different level in all ways with your assessment, with your ability to identify all of these things and document them properly. That way, day to day, week to week, you can really see what the progress is, what it looked like from start to finish, all of that. And because of all of this wizardry that you're going to be doing with your documentation and your assessment, it's going to really allow you to jump in when you may have walked away before. You're really going to be able to be more of a part of a team. You're going to be able to contribute to conversations related to that person's care in a different way than you would have been able to participate before. So you're going to know exactly what you're looking at when you're looking at their skin, when you're looking at their wounds, and you're going to be able to talk to that other clinician, whether it's a nurse, a therapist, a physician, a nurse practitioner, and you're really going to be able to work together. Being informed about this stuff is step one. You have to know what you're looking at, you have to know what you're talking about, and it'll just bring a more well-rounded type of care to that patient's world. So that is how, in a nutshell, that this course is going to make you an improved type of clinician and really be able to up your game in the everyday clinical world. So I do hope that you check it out. It is on our website, rxseminars.net. We are offering live courses, and most recently we are going to be able to provide it in a virtual format as well. So that is a live stream of the actual course, and then later on next year we will also be providing it in a pre-recorded fashion so that you can take it at your leisure. So please check it out. Definitely shoot us a line if you have any questions, but it is a gem. So I hope to see you there.